Hello, I'm Dr. Prathap Chandra. I'm one of the neonatal consultants and clinical lead at Motherhood Hospital, Sarjapur Road in Bangalore. The best form of feeding for any baby is going to be the breastfeeding. Breastfeeding is considered to be the best because it gives the warmth to the baby, it gives bonding between the mother and the child, and breast milk has shown to have all the goodies in them, including the antibodies, the minerals, the vitamins, and all the essential requirements the baby would need for their growth and nutrition. Sometimes, unfortunately, especially after the cesarean section, mothers would not be able to give breastfeeding as adequately. Babies would only need very small amount of breastfeeding, and especially in the first 1 or 2 days, it's going to be the colostrum, which is milk which is yellowish in color, and it is thick and it is full of fat and nutrition, and that is the best form of milk that can be given to the babies. But with the mothers being in pain and after having cesarean section, sometimes it's not always possible for them to produce this. It won't be wrong if we give a stopgap formula feeds to these babies on 1 or 2 occasions during the first 1 or 2 days, but always keeping in mind that the breastfeeding should be established during these times. Mother Nature has designed breast milk in such a way that all mothers will be able to produce adequate amount of milk to provide growth and nutrition for their babies. One of the best forms of increasing the milk production is to be with your baby, and another method which the West commonly calls it as KMC, or the kangaroo mother care, wherein the babies are put direct skin-to-skin contact onto the mother's chest. This would enable mother's hormone to be released in adequate amounts. There are 2 important hormones called the oxytocin and the prolactin, which will help in the milk production as well as the ejection of the milk. The second thing is baby sucking onto the nipples. Make sure that the baby is latching on well, not just to the nipple but to the areolar area, which will help in production of the milk as well as easy ejection of the milk to the babies. One of the ways to find out if your baby is taking adequate milk is to see milk flowing from your breast to the baby. You can see the milk in the baby's mouth, and you will feel fullness in one of the breasts before you start the feeding, and you will have the let down reflex after you have finished the feeding. These are some of the ways of saying whether the milk is produced and whether it's adequate for the babies. And the babies would normally naturally sleep for good 2 to 3 hours after it has taken the adequate feeds. Normally, well-fed babies pass urine up to 8 times a day, and if your baby has not had wet nappies for more than 6 to 8 hours, then it should ring an alarm bell, and then you should seek expert advice from your pediatrician. A baby who's just born will have their stool colors which are dark green to black in color, and this is commonly referred to as meconium. Usually babies pass meconium during their first week of life, and gradually with the introduction of the feeds, the stools change color to light green and then to dirty yellow and to yellow. Most common question the parents and the grandparents ask is about the frequency of the stools. Any baby who's been well fed and breastfed, they pass on an average up to 6 stools per day, which is still within the normal limits. A baby who's on formula fed will usually pass stools once in a day to once in 6 days. This is a big spectrum, and this is within the normal limits. And the other thing to note is the stool consistency in a baby who's on breastfeed is always loose, as opposed to slightly harder consistency when these babies are on formula feeds. and all these spectrum are within the normal range. One of the common questions that parents and grandparents ask us as clinicians would be about bathing their children. Babies can be bathed as early as first or second day itself. It is very important for mothers and fathers to spend time with their babies, so we always encourage them to give babies gentle massage with gentle oils, which can be as light as the olive oils or some of the brands which is available, which is friendlier to the baby's skin. This would always give bonding time and establish good rapport with the mother and the fathers. After the massage, babies can be given bath, and always ensure that you dip your elbow into the water and make sure you are comfortable with the temperature. The temperature with which your elbow is comfortable would be the ideal temperature of the water that the baby will be required. After giving the bath, ensure the baby is clean and dry, and then you can apply some of the moisturizers that is available, which are kinder to the skin. And it is always advisable to ask your pediatrician to go for the ideal moisturizer for the baby. The babies are quite comfortable in an environment where parents and grandparents are comfortable in. This is to set up the room temperature ideally between 18 to 22 degrees centigrade. Make sure that the babies have got cotton clothes on and may need only 1 or 2 blankets depending on what the temperature is at home. The head of the baby has got large surface area. Therefore, if the baby is cold or the environment is cold, it is very important, especially in the first few weeks, to cover your baby's head with a hat. Make sure that you take extra precautions while you are traveling or while you're taking the baby outside. What I mean by extra precaution is making sure that the baby is appropriately dressed for the temperature that is outside. In very cold conditions, especially if you're living in Bangalore, for example, in the morning times, if you're taking the baby for a stroll, make sure that the baby has got a hat, couple of layers of clothes, and then a sweater, and make sure that the blankets are appropriate for the temperature. In the summer times, again, you have to use a bit of a logic and make sure the dressing is reduced. The umbilical cord is a very important connection between a mother and the baby. Once the baby is born, the umbilical cord is clamped and the function of the umbilical cord ceases at that stage. But a common question that has been asked to the pediatrician is, when is the cord going to fall? Very commonly, the umbilical cord falls between first and the second week of life. If it doesn't, even after third week of life, it is better to seek advice from your pediatrician. The umbilical cord care is basically keeping the umbilical cord clean and dry all the time. Make sure that there is no blood or pus oozing from the umbilical cord. And if the baby's umbilical cord is smelly, then ensure that you seek pediatrician's advice, because it could well mean there is an onset of an infection. Therefore, the only thing that you need to do is to keep umbilical cord dry and clean. Do not apply any ointment or powder. One of the most common problems newborn babies encounter is jaundice. All the babies after birth will develop some degree of jaundice. It is extremely important for us to know that the jaundice is not at higher levels. If the jaundice is high, especially in the first 3 days of life, it can enter the brain, get deposited in the brain, and can cause long-term brain damage as well as the hearing loss. One of the common questions the parents and the grandparents ask is to expose the child to the direct sunlight. There are various studies which have shown that exposing to direct sunlight would be more harmful than beneficial. One of the reasons is you have to expose the baby fully to the sunlight to get any benefit. And by doing this, you could be subjecting your baby to cold. And babies, when they are cold, they don't feed very well. Number two, the sunlight that is exposed is full of UV radiations which are not controlled, as opposed to the phototherapy that is given in the hospitals, which are given at a significant well-defined wavelengths to the babies, which are less harmful to the skin. So if you ask a clinician, you should basically report back to your pediatrician if you think the baby is jaundiced. Make sure the levels are checked and appropriate action and the management plan to be taken instead of exposing direct to the sunlight. All the babies that are born will lose weight within the first week of life. The weight loss should not be more than 10% of their birth weight. For example, a baby who's born at 3 kilograms birth weight is allowed up to 300 grams of weight loss after the birth. Normally, breastfed babies take slightly longer to regain the birth weight, and all the babies will regain birth weight by 10 days to 2 weeks of life. Preterm babies, if they're born prematurely less than 37 weeks of gestation, they may take slightly longer time to achieve their birth weight. A baby who's born at term, which is 37 weeks plus, will gain roughly around 25 to 30 grams per day, or about 150 to 200 grams per week. This is ideal weight gain within the first few weeks of life. And normally a baby would double the birth weight by 5 to 6 months of age and triple their birth weight by about a year of age. Again, in this, there is a wide range of spectrum. Some babies may do better than this, some babies may do slightly lesser than this. But we have to take into account the whole picture and make sure your baby is active, alert, following all the milestones the baby should be doing, like sitting, walking, having the head control, appropriate age. And if you have any concerns with regards to any of these, along with the weight gain, then it is appropriate for you to seek your pediatrician's advice.